Welcome back. Today's episode is all about sleep, why it sucks in perimenopause, the factors that impact your sleep, and some steps to take to improve it. If you're like the thousands of women in my community, you may have noticed that your sleep isn't as good as it used to be. With the decline in hormones in your 40s, it is very common to experience sleep disruption. And that could look like not being able to fall asleep at night, or waking up in the middle of the night and not being able to fall back asleep, or just waking up really early in the morning. In fact, women in perimenopause are most likely to sleep less than 7 hours on average as compared to premenopausal and even postmenopausal women. I know, we're super lucky. In case you're not aware, insufficient sleep is associated with an increased risk of cardiovascular disease, diabetes, obesity, and even depression. Not to mention the relentless fatigue that you're likely experiencing, lack of productivity and motivation, as well as irritability and even anxiety. Look, I'm sure I don't have to convince you that sleep is really important, but I do want to try to convince you to get on top of this, because if you're not sleeping, obviously you're not going to feel your best. And I see it all too often where women will go for years with crappy sleep, just assuming that it's part of getting older and they just have to accept it. But you don't have to accept it. You can actually sleep. We have helped many clients get the sleep that they need, especially in this stage of life. So let's talk about what's happening, and then we'll talk about some steps that you can start putting into place. So if you're not sleeping well, the first thing I'm thinking is that you have a disrupted circadian rhythm or sleep-wake cycle, meaning you're likely not getting enough natural light in your eyes during the day and probably too much artificial light, especially at night. So as a result, you may have low melatonin levels. Melatonin regulates your sleep-wake cycle. So darkness is what signals your body to produce melatonin. It's primarily released by a small gland in your brain, but an important one called the pineal gland. And that is inactive during the day, but when the sun goes down, as it starts to get darker, this gland is essentially turned on, and that's what starts to produce melatonin. However, if you're always on your phone, always on your computer, TV, devices, especially at night, you're stimulating your nervous system, and cortisol is going to stay up and melatonin is going to stay down. Our hormones do not work in isolation. They work as a team. So when cortisol is up, melatonin is down. When melatonin is up, cortisol is down. All right, that brings me to dysregulated cortisol. So again, instead of cortisol being low at night, it's likely elevated. Your body will not relax in order to fall asleep and stay asleep if you have elevated or dysregulated cortisol. That's why you get that tired but wired feeling, like you're so exhausted, but you just can't fall asleep. Yeah, that's cortisol for you. And this is why it's really important to have a relaxing nighttime routine, which I'll talk about in a little bit. The other thing to think about is you probably have low progesterone, which is to be blamed if you cannot fall asleep. Now, remember, after the age of 35, this hormone declines drastically. The other thing to think about is you may have low estrogen, which is to be blamed if you are waking up in the middle of the night, especially if you're waking up because of hot flashes or frequent urination. Now, many women tell me that they wake up at 3 a.m. or 4 a.m., and often because they have to go to the bathroom. So in a nutshell, progesterone is what makes you or helps you fall asleep, and estrogen is what helps you stay asleep. We need both. All right, the other thing to think about is you may be having blood sugar dips, and this is going to cause your stress hormone, cortisol, there she is again, to peak, and that's going to wake you up in the middle of the night. So this is where your diet really comes into play. More on that later. All right, the next thing I want you to think about if you're not sleeping well is your gut. We need optimal gut health for a number of reasons, such as hormone production, neurotransmitter production, and side note, serotonin is a neurotransmitter, and 95% of it is made in your gut. It is the precursor to melatonin, your sleep hormone. So the other reason why we need optimal gut health is so that we are able to properly absorb the nutrients from our food. We need a lot of nutrients so that we can feel our best, including making sure you're getting optimal sleep. The other thing our gut does is it manages inflammation. It wards off pathogens like parasites. Those buggers are typically inactive during the day, but at night is when they get really active, typically around 2 to 3 a.m., which is when a lot of women say they're waking up. So this is going to create a stress response in the body. It's going to increase inflammation. It's going to drive up that cortisol and or adrenaline and wake you up. Lastly, there is evidence that the bacteria phyla, Bacteroides, which I always say wrong, and Firmicutes, which dominate the entire digestive tract, including your mouth, your nose, your throat, and your colon, can influence your sleep quality and circadian rhythm. And then the last thing I want you to think about if you're not sleeping well is sleep apnea. A lot of women don't realize that this can be something that they experience because a lot of women think it only happens to men or it happens in older people, but that's not true. Sleep disordered breathing is essentially when something is blocking your airway, like your tongue, your tonsils, or even your adenoids, over and over during the night, and that stops you from breathing during your sleep, right? Multiple times. And about 1 in 4 women are at high risk for sleep apnea, and over 90% of women with sleep apnea go undiagnosed. Which is insane. And getting up multiple times a night to use the bathroom is a sign of sleep apnea. And research has actually shown that 80 to 90% of people who have frequent nighttime urination also have sleep apnea. So the other thing to think about is if you wake up with headaches in the morning, it could be very likely that you have sleep apnea because you are being deprived of oxygen during the night, as well as that deep sleep. If you want to dig deeper, check out the link that's in the show notes. All right, so now that we have an idea of some of the causes of your sleep disruption, let's talk about some things to put into place. Number one, you want to have a relaxing nighttime routine. So ideally, you would start about an hour or so before you want to be sleeping. So say you want to be asleep by 10 to 11 p.m., make sure you are starting a relaxing nighttime routine around 9:30, right? Don't just like keep working and being on your computer or your TV or your phone and then get into bed thinking that your body is just automatically going to shut down and go to sleep. That's just not how it works, right? We have to get our body into a rested state. So really start putting this into practice where you're getting to bed or getting ready a little bit earlier every night until you work up to at least an hour before. That's going to be really beneficial in just like bringing your cortisol down and letting melatonin do its thing, right? You want that melatonin to produce at a decent level so that you get tired and you fall asleep. That's going to include shutting down lights, shutting off devices. So if you have a TV in your room, get rid of it. This is something that we tell all of our clients to do, and it really does make a world of difference. The other thing to consider is what is your bedroom environment like? Is it relaxing? Is there a ton of clutter? Do you have laundry and kids' toys and pets all over the place? That's not super relaxing. So make your bedroom a really tranquil environment, if you will. You also want to think about any light that's coming in. If you have light, whether it's from an alarm clock, a fire alarm, your window, the moon even, that can really affect your sleep. So either get some blinds or something to cover that stuff or get an eye mask. I will link to my favorite in the show notes. And then also consider like some sort of white noise. We use an Air Doctor air filter. So we're kind of killing two birds with one stone. We are cleaning the air in our environment. We also have carpeting here. And then the noise is really calming, so that helps us sleep. And then lastly, you want to make sure that your temperature in the bedroom is cool. So we like it around 65 in the winter months. All right, the next thing you want to think about is getting plenty of sunlight. So I mentioned earlier how you may have a disrupted circadian rhythm. So you want to get outside early in the morning, even if you're living in cold climates like I am in New Jersey. Try to get outside for a walk or something, even if you're sitting on your backyard, your patio, to get the natural light in your eyes. Do this without sunglasses because that's going to signal your brain that it's time to wake up. So melatonin will come down and cortisol will rise for the day. That's going to give you energy. It's going to give you that oomph to get you going in the morning, right? And then ideally, you would also have a walk later on in the day, maybe in the afternoon or even the evening after dinner. And that's going to prepare your body to relax. And then, like I said, lower cortisol and then increase melatonin so that you get ready for bed. The other thing you want to think about is movement, of course, right? Getting movement every day is really important. I think that as a society, we are way too sedentary. So make sure you're walking every day. If you can incorporate some sort of strength training a few times a week, that is really ideal, particularly in this stage of life. Let's talk about your food now because I said earlier that, if you're having blood sugar dips, that's going to wake you up in the middle of the night. So you want to make sure that you are eating the appropriate amount of protein and carbohydrates for you, for your age, your weight, your goals, and so on. Typically, just a general rule of thumb, you want to aim for the same amount of protein in grams as your weight. So, say you are 130 pounds, you want to aim to eat about 130 grams of protein per day. Most of it should be animal based. Of course, you can throw in some plant protein in there as well, but you want to make sure that you're getting all of the bioavailable nutrients from animal protein. Okay. A lot of women will fast overnight, and that's fine if you like to do that, even like a 12 to 14-hour fast. However, some women need a little snack in the evening to help them sleep well. So you have to experiment with this. Don't be so steadfast in your rules around fasting, right? You want to really see what works for you. And that may mean you have to experiment a bit and just do what you have to do to make sure that you're getting the sleep that you need. The next thing I want you to think about is caffeine. If you're somebody who's drinking a lot of coffee or caffeinated teas or even chocolate, reconsider that because caffeine, the mean half-life of caffeine is about 5 hours. Now, caffeine's elimination half-life can range between 1.5 to 9.5 hours. Got that? 9.5. So do the math, right? If you're trying to get to sleep by 10 o'clock, 11 o'clock, and you're having coffee in the afternoon, that's not great, right? It's going to stay in your system and you may not be able to fall asleep. So really think about your relationship with caffeine and the scheduling around when you're having it. All right, this is a big one. I want you to think about your relationship with alcohol as well. A lot of women will drink alcohol, at the end of the day to relieve their stress, socially. But in this stage of life, in perimenopause and beyond, it does not serve us. I have seen too many women struggle because they are drinking alcohol, and so many women feel so much better when they eliminate it. Now, I'm not saying you can never have a drink, but really think about how you feel when you drink. Really pay attention to your symptoms because alcohol disrupts your sleep cycle. Now, normally we go through different stages of sleep, including deep sleep and REM or REM sleep, which is rapid eye movement, and that is essential for feeling rested. If we don't get enough of that, you're not going to feel rested. So alcohol also has a rebound effect. So as the alcohol in your system begins to metabolize, we experience a rebound effect. This means that we find ourselves awake. We could be tossing and turning, especially during the second half of the night. The other thing is that alcohol can contribute to night sweats, and we are already dealing with those in perimenopause, so why add fuel to the fire? Pun intended. All right, the next thing I want you to think about is where do you keep your phone? Is your phone right next to your bed on your nightstand? Probably not a good place for it to be. Not only because we're going to be exposed to Wi-Fi, but also you're going to be tempted to reach for that phone if you wake up in the middle of the night. It's a really bad habit, and it's a really hard cycle to get out of if you're somebody who has chronically been struggling with poor sleep. Because if you're reaching for your phone, then you're scrolling Instagram or you're checking email. What do you think that's doing to your cortisol? And then what happens to your melatonin? Go back to what I said earlier, right? So get rid of the phone. Put it in another room or put it on the dresser somewhere where you are not tempted to reach for it if you happen to wake up in the middle of the night. Obviously, the other thing to think about is your bedding. Is it comfortable? Is it too hot for you? Do you need cooling sheets? Do you need something like a chili pad so that you can better control the temperature, especially if you have hot flashes? Another thing to consider is adding in some magnesium. So magnesium is one of the most beneficial minerals that we all need, and unfortunately we lose it. Our soil is very depleted. We're not getting enough from our foods when we're stressed out, which who the hell isn't nowadays? We lose magnesium. The thing is, a lot of people will take pills and they're not absorbing it properly. So I personally like to do a mix of pills and also topical magnesium. So there's a cream that I really love that I will link to in the show notes for you to check out. The other thing to consider is melatonin, but not just any melatonin. One that I really like that we've been using with clients successfully is Herbatonin. This is by a company called Symphony Health. It is a plant-based melatonin, so it is a powerful antioxidant melatonin. It's not just your sleep hormone. It's going to protect your liver. It counteracts inflammation. It protects your DNA from damage, and it's super helpful for migraine and even pain reduction, as well as estrogen metabolism. And in this stage of life, that's really important important, especially if you're taking hormone replacement therapy. So many melatonin supplements on the market are synthetically produced. They often come from chemicals in a lab, and they contain different preservatives, artificial colors, or flavors. They're also going to start at really high doses. And that's not recommended for long-term use. Too many people will be on really high doses of melatonin for long-term. You don't want to be taking that really long-term. Too much melatonin can result in side effects like reduced sensitivity of the hormone receptor sites, as well as making it harder to fall asleep and even feeling drowsiness the next day. So on average, your body produces about 0.1 milligrams to 0.8 milligrams of melatonin per day, depending on your age. So ideally, you would start at that physiological dose that I mentioned, which is 0.3 milligrams. Yes, 0.3 milligrams, not 10 milligrams like a lot of people are taking. So that's why I recommend this brand, Symphony Health, their Herbatonin. So I'm also going to link to that in the show notes so you can check that out. You also want to think about testing your minerals with an HTMA. That's something that we use with clients, hair tissue mineral analysis. That's going to look at your calcium, your magnesium, sodium, potassium, and so on. It's also going to give us insight into your thyroid health, your adrenal health, your blood sugar regulation. And all that is important in order to achieve optimal sleep. And then you may also want to consider a GI map. I mentioned earlier how when there's inflammation in the gut, when there's parasites and dysbiosis, which is an imbalance of gut bacteria, that can affect your sleep. So we utilize a GI map stool test with our clients to see what their gut is looking like. And of course, you want to get some blood work done. That's going to assess your metabolic health, thyroid health, immune function, and so on. So I mentioned earlier that in this stage of life, you likely have low progesterone and or low estrogen. We want to do our best to mitigate the ups and downs that are happening in this stage of life. So progesterone certainly helps with that, but sometimes bringing estrogen in will help as well. So in terms of what to consider and what to talk to your provider about, if you are struggling with sleep and even anxiety, you want to talk to your provider about oral micronized progesterone. Again, this is the first hormone typically that is going to decline after the age of 35, and it greatly impacts your sleep. You may want to consider doing something like an estradiol patch or a cream or a gel. There's different options, of course. Again, talk to your provider. You want to go for bioidentical hormones whenever you are discussing BHRT or HRT with your provider. All right, that was a lot, but hopefully that gave you some insight into why you're struggling with sleep and some practical action steps that you can take. Talk to you soon. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my 6-month comprehensive program, The Hormone Rescue, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and so much more. We do this by utilizing functional testing, comprehensive blood work review, a personalized plan tailored to you, women's health and hormones education, and ongoing support. If you're ready to commit to your health and feel better than you have in years, check out the link in the show notes to learn more about the Hormone Rescue.